common name, high blood pressure, hypertension. You might even see it written as HTN, which is an abbreviation for it. What is it? Blood pressure readings are usually composed, they're always composed of two numbers. The top number is the pressure that you have inside of your arteries when your heart is contracting. So when your heart is pumping, part of that is contracting and releasing. So when it's contracting, it's the pressure that's inside in your arteries, okay? And the bottom number is the pressure inside of your arteries when your heart is relaxed. So if that's a fairly okay blood pressure, 130/80. You might see 120/70, you might see 110/60, 110/70. If you go, you may even see 90/60. You don't want to be going below that. And you don't really want to be going higher than 139/80 or over 79. On the normal run of things, you don't want to go over that. And most people don't, but a lot of people do. So there's a lot of people in our communities that have high blood pressure and they're on medication for high blood pressure. African Americans historically are genetically kind of predisposed to it for a number of reasons. It runs in the family, so they may have a family history of it. It's not really a genetic predisposition. It's more, it may run in families. Anybody that has high blood pressure really needs to get one of these little machines. You can buy them in Walgreens. I think Medicare may cover some. Disability might cover some. Just that you can take it randomly throughout the day, and it's going to be different throughout the day. So blood pressure medicine will lower blood pressure. Okay, the most important thing you can do if you're prescribed blood pressure medication is to take it on time when you're supposed to take it. If you're supposed to take it in the morning at 9 a.m., take it in the morning at 9 a.m. Don't take it at 11 a.m. Make sure you wake up to take it, or you're supposed to take it at 8 a.m. and then maybe again at 5, whatever times you're supposed to take it at. Try to take it at that time. If you have to leave little triggers, little alarms on your phone, or whatever you need to do to take it on time. 90% of people that take their blood pressure medication on time achieve control of blood pressure. If you have high blood pressure, you have high blood pressure. It's something you're going to have for the rest of your life. It's not something that's going to go away by itself, or it'll go away with medication, but you're still on medication. If you don't take the medication, it'll come back. The most important thing is, so 90% of people that take their medication on time achieve control of their blood pressure. 50% of people that don't take their medication on time may achieve control of the blood pressure. Blood pressure, high blood pressure happens for a number of different reasons that we're not really going to go into. We're just going to look at the blood pressure itself. Often people are on one medication a day for blood pressure. Some people are on 2 or 3 different kinds of medication for blood pressure. Other people are on 2 or 3 different kinds multiple times of the day. They could be on it morning and evening. They could be on it 3 times a day. It depends on the control that they need to achieve and on the reason why they have the blood pressure. If your blood pressure medication causes some side effects, do not stop taking it. Just call your doctor, let them know that you're getting certain side effects and you haven't had, it could be anything. And you haven't had it until you started your blood pressure medication. They'll take a look at the dose. They might be able to lower the dose, or they may be able to switch you to a different kind of blood pressure medication. And yes, it will keep you from having a heart attack, controlling your blood pressure, And more importantly, it will keep you from having a stroke. Okay. So in that way, it can save your life. People that have strokes have said different types of strokes, okay? They may feel dizzy, they may collapse, they might wake up in the morning with a blinding headache, not like your regular, not even like a migraine headache, just a really, really bad headache, and shortly after that, they end up getting a stroke. So if you're overweight, lose weight, that will lower your blood pressure. Choose a diet that's low in fat, rich in fruits and vegetables, and low fat dairy. Your diet can, if you stick to a particular diet, okay, and I hate to call it diet, if you stick to a particular eating habit, because it isn't a diet, you're just watching what you're putting in your mouth. You're watching if you're eating too much salt. You put too much salt type seasonings on food, too much fatty foods, that kind of thing can increase your blood pressure. If you're on blood pressure medication and you really watch your diet as well, you can end up being on a lower dose of medication. You probably won't end up coming off it altogether. It depends on your age. If you're young, 25 with high blood pressure, maybe changing your diet, doing some exercise, you might end up coming off your blood pressure medication. But it's always something that you need to be aware of, because you may not achieve no medications, but you will be able to get your dose down. Do something active for at least 30 minutes a day on most days of the week. So that's not necessarily 3 days of the week, it's more 5 days of the week. Reduce your amount of alcohol if you drink more than 2 alcoholic drinks per day. It doesn't mean that you have to stay away from alcohol, but you certainly shouldn't be overusing alcohol, but that goes for any disease process. I did want to say something about doing something active for at least 30 minutes a day. And I talked about this the other day as well. If you have not been used to exercise, or if you've been somebody that has walked all your life, that's fine. You know your limitations, you know what you can do. If you're not somebody that has exercised, start off walking. You don't need to be jogging. It doesn't take that. That's not the kind of physical activity it's talking about. Walking, start off walking and do it on time, not on distance. And gradually build up your time until you get to 30 minutes. If you haven't exercised and you go out and you walk 30 minutes and you're going like, fast and everything else, I guarantee you the next day you're not going to be doing anything, because you're hardly going to be able to move. Okay, so start off slow walking, do maybe 5 minutes for the first week, do 7 minutes the second week, gradually build it up to the 30 minutes a day on most days of the week, and most days is usually 4 to 5 days a week, and you can alternate it. Control and prevention is lifestyle. Lifestyle meaning what you eat and how you exercise. And it can also prevent you getting high blood pressure. Changing your diet habits, changing your exercise habit can prevent you getting high blood pressure, especially if you have blood pressure problems in the family. Blood pressure is related to heart disease. It's related to plaque, in the arteries. It's also related to kidney disease. It's very prevalent, and you often can be the first sign of kidney disease. And uncontrolled blood pressure can damage the kidneys, or uncontrolled blood pressure can further damage the kidneys. And a lot of people, I'm sure you're aware of these facilities, end up on dialysis once you start to really damage the kidneys. The kidneys are a filtration process for the body, and they get rid of the toxins that are in the body, the waste products. That's how the kidneys work. and we excrete waste products, and we excrete drugs that we've taken, you know, medications that you're taking gets excreted in the liver, they get metabolized in the liver and excreted in the kidneys. So I know I've said this multiple times before, Megan has heard me say this. So I have a home care agency and I take care of seniors. My one thing that I've always said is there's no such thing, now we have 2 young girls here that don't probably, this doesn't mean anything to them right now. There's no such thing as anti-aging, it's a myth. It's a myth that was invented by the beauty industry. There is no such thing as an anti-aging cream, no such thing as anti-aging anything. Even if you get plastic surgery done, you have a facelift, I guarantee you it will begin to drop after 10 to 15 years. And you'll be back 20 years later where you started. As well as inside our bodies, our outside ages, we see it ourselves. Look back on photographs. When you were 20, you do not look the same as you did when you were 20. Your body ages inside the same way, but we just don't see it. That's why as we age, even as we get older in years, we want to develop good diet and exercise habits so that we can prevent a lot of these kind of diseases attacking our bodies. Because as our kidneys get older, they're not able to work as well as they did when they were younger. The same with your heart, the same with your brain, same with your liver. If you drink too much alcohol, your liver isn't going to be able to metabolize it, and you're going to damage your liver, where you end up getting cirrhosis and all kinds of other stuff. When you're younger, now is the time to develop those good habits so that they stay with you as you get older. Foods rich in calcium, you can see soya, cheese, beans. I don't know what this is actually. I don't know if it's tofu or it's cheese.
It's hard to tell. It kind
It's
of
hard
looks like
to
a
tell,
block of
actually,
feta,
isn't it?
doesn't it?
Yeah. And then you have, these are foods with calcium, foods with vitamin D. Vitamin D is very good. We should all be taking vitamin D. Everybody should be taking vitamin D, especially in this area. Yes, it's fine now, the summertime. You know, in the winter time, we're not getting it. You're working, you're not getting vitamin D. You're going out in the dark, you're coming home in the dark. You get vitamin D from the sun. I don't have the statistics, but I know some of the breast surgeons and the breast cancer people advocate vitamin D for every patient that they see. Everybody should be taking vitamin D. And you can buy it over the counter and it is safe. It's usually like a water or a fat soluble. So if you're going to take your vitamins that are fat soluble, make sure you take them with some fat, maybe some milk or some butter or an avocado, because they get absorbed better when they're accompanied by fat. If you don't take fat with them, they won't get absorbed as well. So here we have your vitamin D foods, and then what's in the middle here is your yogurt, your milk, some cereals. And I just, you know that this is what's written on every food source that you get. Every packaged food source. We don't have this written on radishes or on onions or on produce. There's no need to write it. It's real food. I have heard the expression that we don't get fat from food. We get fat from things that aren't food sources. So packaged stuff, processed foods, that's where we get fat from. Real food, real produce, real meat, none of those have ingredients on them. It's only the processed foods that have ingredients on them. You can see here dietary fiber, and the doctors recommend that we have 25 to 36 grams of fiber a day. Okay, and this, I don't know, like you see serving size, your total fat, you don't need to look at this as much. Saturated fat is like a chain of fats. Polysaturated fats are multiple chains of fats, and they're harder to digest and harder to process. Cholesterol, sodium, that's a huge amount of sodium. 210 degrees of milligrams of sodium, that's a lot. Anybody with high blood pressure does not want to eat whatever this is. There's too much sodium in it. And sodium, like if I put, and I'm sure you've seen it, if you put salt on the table and you pour water into it, it absorbs the fluid. So imagine that inside in your body. It's going to make you bigger, bloated. It's going to make you hold on to more volume. So you drink water, salty, you're eating a lot of salt, you're going to hold on to the volume. And when you hold on to the volume, it'll go around your ankles, it'll go here around your neck, it'll go onto your lungs, it'll go into your arteries. You're holding on to volume and your blood pressure is going to go up because the volume in your vessels is going up because the salt is making you hold on to water and fluids of any kind. That's why it's a problem for blood pressure, because the salt makes you have greater volume of water in your body, and that's how your blood pressure goes up, with the extra volume. Okay, exercise and high blood. Regular exercise is recommended for prevention and lowers currently high blood pressure. Other health benefits include a reduced risk of cardiovascular disease, diabetes, lipid disorders, your high cholesterols, your high triglycerides, breast and colon cancer is something that diet and exercise have been related to. With regard, you know, we hear everybody saying 10,000 steps a day, and that's the kind of desired amount that we should have of exercise. Reduces your risk of weight gain, frailty, and bone disease. Bone disease because of extra weight on your bones and your joints. Other bone diseases like osteoarthritis. If you have rheumatoid arthritis, that extra weight will make it worse. Cardiovascular disease, diabetes, the lipid disorders, cholesterol, triglycerides is more in your liver, but cholesterol plaque will gather in your arteries and up with your blood pressure. Types of exercise, there's dynamic aerobic exercise is the type of exercise that is kind of desired. It's regular purposeful movement of the large muscle groups in moderate or vigorous activity that places stress on the cardiovascular system. You have to get your heart rate up during exercise for it to be of benefit. If I have a heart rate of 80 and I'm exercising and my heart rate isn't really going up, it's not benefiting me, okay? It's not aerobic, okay? This is dynamic aerobic exercise. It gets your blood moving, it gets your lungs aerated, you know, you're breathing faster. But I mean, if you're getting chest pain doing that, you need to stop. That's why I said earlier about building it up, 5 minutes, 7 minutes, build up to your 30 minutes. Things that are considered dynamic aerobic are brisk walking, jogging, depending on your age, you know. I won't be jogging, I'll tell you that. Dancing, bicycling, swimming, and other exercise equipment such as elliptical machines. Swimming is a really good exercise because swimming is helping your breathing. You're moving your limbs against the water, which is like weights, and you're getting the aerobic as well. But as with everything else, start off small and build up to a time, 30 minutes a day. So at least 150 minutes of moderate to intense physical activity per week. Moderate to intense, you build up to moderate, you build up to that. Over time, you build up to it. And you're looking at five or more days a week, 30 minutes. But when you start off exercising, it's really important to build up to it. In the hospital, in the winter time, we would hear about, and we see it all the time, people out there shoveling snow having heart attacks. They didn't build up to doing that kind of physical activity, puts a strain on their heart. You know, if they were exercising all the time and doing that kind of activity, it wouldn't do that. Stroke. So I talked about blood pressure, the high blood pressure. That's the reason that the blood pressure needs to be controlled is so that you don't have a stroke. It can be called brain attack. In more recent times, they've begun calling it brain attack because it's like heart attack. It's as serious as a heart attack. It's a brain attack. Cerebral vascular accident, or a CVA, you may hear it called that. It all means the same thing. It's all a stroke. So stroke is the term doctors use when part of the brain is damaged because of a problem with blood flow. Okay. The blood flow, strokes can happen when the artery to the brain gets clogged and closes off, and part of the brain goes without blood for too long. Okay. There's the lack of blood supply causes part of the brain to be damaged. Okay. Lack of blood supply anywhere in the body is going to cause damage. When babies are born, they have the umbilical cord and they tie off the umbilical cord with an elastic band or a clamp or something, and eventually it goes back black and falls off. It goes black because they clamped it off, because they stopped the blood supply going there, and that's why it falls off. You see people with gangrenous toes, diabetics that haven't been taking care of themselves. It's the lack of blood supply to the lower limbs that causes that to happen. And it does the same in the brain. Or you can have an artery opens and starts bleeding in or around the brain. So there's two kinds of strokes. The first one that's clogged, where the arteries are clogged off, is called an ischemic stroke. And literally it just means that there is a thrombus or a clot here, and it's stopping the blood supply going to that area. And wherever that is where the damage is going to be done. Anoxia is a lack of oxygen. So you know that our blood has hemoglobin in it. So if there's no blood supply, there's no oxygen going to the brain either. The other one is a hemorrhagic stroke, and that's when a vessel ruptures for whatever reason, and it's a hemorrhage. Okay, but it still causes damage. One, the thrombus, clogging, stops the blood supply to the brain. The other one, a vessel ruptures and it bleeds out, so therefore there's not enough blood getting into the brain. And they're the two types of strokes. What you see more in seniors is the ischemic stroke, the clotting, the clogged arteries. You see that more in the senior population, but you can also see the hemorrhagic one. If somebody falls and they bang their head off the ground, usually it's this kind of that's the kind of stroke they end up with, or that's the kind of brain damage they end up with. The other one that you see is an aneurysm. People may have a brain aneurysm. It's a bulging kind of, you know, it's like a bulging in the brain, and it breaks up, you know, it snaps, and the blood, it bleeds, and because of the bleeding, there's not enough blood going to the other parts of the brain. So the effects of a stroke depends on which part of the brain is affected and how quickly the stroke is treated. So my mother some years ago was out with a couple of friends, like at a women's thing, but I don't know where it was, but they were all out. And her friend, Dolly was her friend's name, said, "I don't feel well, and my arm is starting to feel tingly." So that was okay. They kind of just said, "Oh, well, we'll be going soon anyway." Then she kind of began to slur her speech and could hardly walk. So they put her into the car and they brought her home. They settled her at home. They called her son. Her son came over to her, and then he called the ambulance. I've been a nurse for a very long time. I can assure you, when I heard this story, I just cringed. What they should have done when she felt tingling going down her arm, they should have called 911 then. Not taken her home, not see if it wears off, you know. She obviously had some blockage. So it is a medical emergency. Some can be treated, others can't. Some people who have strokes, they don't have lasting effects, but we'll talk about that later as well. They may not have what they call any deficits. It just might be, you know, a little blockage. They did have the stroke, and they'll diagnose the stroke on a CT scan. They do a CT scan as soon as somebody comes into the hospital. They'll go down straight away. There's a stroke protocol that they use, and they want to be able, from front door of the emergency room to completion of the scan, to be 30 minutes maximum. Other lose important functions. For example, people get paralyzed or they're unable to speak. Stroke is one of the leading causes of death and disability in the world. Okay, the brain goes down this way and it crosses over here at the back near the medulla. So it's your left brain that controls your right side of your body, or your right brain that controls the left side of your body. So if you have any kind of paralysis on your left side, the stroke was on your right, the right side of your brain, and vice versa. And speech is on the right side of the brain as well. So some people, their speech is affected, other people, their speech isn't affected. And it depends on what side of the brain that had the stroke. Fast. This is how to tell if someone is having a stroke. Their face is uneven. They may have like a drooping at the side of their face. Their arms may be weak, they might drop something, or they feel that tingling in their arms. Their speech is a bit off or strange, or it doesn't sound right. They may be using words that don't make sense, or words that are inappropriate in the sentence. And then it's time to call an ambulance, and the ambulance you call is 911. You don't call anything else, only 911, because it's an emergency. So this is a way to remember it: fast, face, arms, speech, and time to call the ambulance. Sometimes some people have put in be fast, only because they're looking at balance, which can happen. People are kind of swaying, or they can, you know, they get up funny off the chair, and the eyes, they can have double vision. Problems with their eyes where they can't see properly. And that has to do with whatever side the stroke is actually happening on. So if anybody shows, anyone you know shows any of these signs, call 911. If it doesn't end up being a problem, that doesn't matter. At least you erred on the side of caution. And the hospitals or anybody else, it won't matter. They don't care. They'd rather have you call and be safe. So the right treatment depends on what kind of stroke you're having, and if you need to get to the hospital really quickly to figure out, is it a hemorrhagic stroke or is it an ischemic stroke? And because the treatment is different depending on what type of stroke it is, and the CT scan will tell you what type of stroke it is. Clogged arteries can get treatments to reopen the clogged arteries, and these treatments can help you recover from the stroke. So the neurologist can go in there and they can remove a clot or remove, they kind of go in with a coil and they can remove wherever the blockage is. It's an interventional procedure done in the radiology area. It isn't a big surgical procedure. that you would have done in the OR, but you still don't want to get into the situation where you're getting clots and they have to go in like that, because once you've had one stroke, you're susceptible straight away to getting further strokes. Medicines that can also prevent new blood clots, and they can also prevent future strokes. So if you've had one blood clot, you're going to be put on different medications so that you don't get a recurrent clot. Because it may not be your brain the next time, the clot might be in your heart. It could be somewhere else, okay? Yeah, there is treatments. You can recover. You can have no deficits at all. You have a greater chance of recovery if one gets to the hospital quickly. Some people never recover. Some people, and we've all heard of them, have hemorrhagic strokes, and that's it. You know, they don't end up regaining consciousness or whatever. People whose strokes are caused by bleeding have treatments that might reduce the damage caused by bleeding in or around the brain. So they can go in there and they can kind of cauterize off the arteries or cauterize off where the bleeding is. But that would be a full open craniotomy. Stop taking medicines that increase bleeding or take a lower dose of bleeding. You know, the Coumadin or warfarin, they're what we call the blood thinners. You've heard people talk about blood thinners. They put you at risk of having a bleed to the brain. But that's why they monitor them very closely. Anybody that's taking Coumadin or warfarin usually has a blood test done every so many months so they can gauge and see what they're doing with the medication so that there's no chance of you bleeding. Have surgery or procedure to treat the blood vessel to prevent more bleeding, but it's not always possible. It depends on where it is, what part. They're not going to go into an area of the brain that's going to cause further damage or that's going to cause, harm. Prevention of stroke. Not all strokes can be prevented, but you can lower your chances of having a stroke. Take your medications exactly as directed and make lifestyle changes like exercise, stop smoking, change diet habits if you feel that your diet isn't healthy, and lose weight if you need to lose weight. Transischemic attacks. I'm only just going to mention these, okay? Transischemic attacks, it's like a stroke, but it doesn't damage the brain. It happens when an artery in the brain gets clogged or closes off, and then it reopens again by itself. So it can close off and reopen. What people have described, so they don't have any lasting symptoms or effect, but they are serious. And if you have had a TIA, you're have had a much higher risk of getting a stroke in the future. Some people report feeling dizzy, kind of falling backwards, or stumbling for no reason. And it's always something that you need to have checked out, because it could be this transischemic attack, which is, like I said, a little clot forming, and it goes away again. You don't have any deficits, and it reopens again, but it's still worth looking into. And if that's the case, they will put you on medications so that it doesn't recur. Does anyone have any questions?
Both my mother and sister were on medication for high blood pressure. Both of them had TIAs, and their blood pressure was under control.
Yeah.
So,
Yeah. You can still get a TIA even if your blood pressure is controlled. It can still happen. It may or may not be related to the blood pressure, but high blood pressure puts you at greater risk of those things. but you can still get them. Yeah, but they never had a stroke.
My mother had strokes.
She had
after that,
strokes
but
after
started
that.
out with the TIAs, yeah.
Yeah, but it began with the TIAs. And how did the TIAs present? Was she,
Well, that's many years ago. so,
Yeah.
My sister's was this.
They showed you
phase,
that.
Not.
And it would go away by itself.
She was hospitalized for
Okay.
that, but
Okay.
yes, I mean, there
And
wasn't.
they
any
diagnosed
lasting
it, yeah.
damage.
So they didn't, on a CAT scan, there was nothing to see.
I
It
guess.
just, yeah,
Is it possible, like with the TIA, that you wouldn't even know you had it?
yeah.
Like, could they
It
go
can
away
be.
as quickly as like if I'm sleeping and I wake up the next morning, or not that fast? Okay, it's a little longer than that.
Yeah, usually it's not going to happen that way.
Okay,
You're not necessarily going to notice. You will notice, but you may not notice.
But you
So
might
if you're
just be-
sleeping, you wouldn't notice.
yeah,
There is, when they do a CAT scan, sometimes they refer to something as being like, oh, there's a lot of ischemia there. There's a lot of little blockages, but not significant enough to necessarily cause anything.
mhm, okay,
But TIAs, like you said, the drooping,
Mhm.
maybe waking up with face drooping.
sure,
I don't know if you can get them through the night like that and
Right.
not have a deficit from it. They're little, you probably can, because what they are is like opening and closing,
Like a
closing off
brief-
and opening again.
mhm,
It's brief. But it does put you at higher risk of having a stroke. And it is something that would need to be treated. And if your mom had it and your sister had it, then, you probably want to see if your doctor can check you out for it, Send your primary care doctor can get a visit with a neurologist and they'd be able to check it out. Or a cardiologist, but neurology or cardiology will take a look at it. Usually it's neurology for the brain.
Do they still recommend taking aspirin if you think you?
I've heard something contradictory to that lately, but I heard somebody said to me that they're not recommending it anymore. They did for a very long time, but I've just heard very recently, and I can't, I haven't looked at, like, last week I heard it, my grandmother was very, very heavy. She was over 300 pounds and she had osteoarthritis. And this is back in the 70s, 80s. And she took aspirin. The 3 she ate, she just, the 325 milligram of aspirin for the pain of the arthritis, because you can get them over the counter. She never had high blood pressure and she never had a stroke, which really is surprising because she was over 350 pounds. And I often wondered later, was it the aspirin?
right,
It saved her.
Yeah, was it the aspirin, because she should have had high blood pressure and she would have had, no wonder she didn't have a stroke because she was so heavy. But she literally, I remember seeing her put the bottle up to her mouth. Who takes it like that? But 81 milligrams of aspirin, we were all told to take, and I think there's been, if they're not recommending it anymore, then it's new. I would like to know why. And because some doctors have said that everybody in the world should be on it.
They just want to push pills.
Well, aspirin has been found to be, at that low dose, has been found to be similar in effect to warfarin or Coumadin, that kind of keeps the blood flowing and not clotting. So, and then you can have atrial fibrillation if you have palpitations. Some people have palpitation. you can get the atria of the heart will fibrillate and throw off a little clot. And that's why most of those people are taking Coumadin or warfarin. It's the same thing. They're just a brand name and a generic name. To be able to, for the clots not to cause a problem. Alternatively, if you don't have those problems, you can take 81 milligrams of aspirin. But just be aware of the tube if you fall or anything, you know. Yeah, I don't want to speak to it because, like I said, I heard recently that they're not recommending it, but I haven't read enough about it to know why. They always did recommend it for the longest time.
Change their mind.
They changed their mind. Pity they didn't tell me ahead of time.
Oh,
Does anybody else have questions?
My nephew-in-law, or I call married to my niece, had several of those TIAs.
Yeah.
And a stroke at, I think he was like 36, so it affected his brain, and I don't want to say he's sometimes he like not there, or
Yeah.
but
Yeah.
we didn't know him back then.
Okay.
And he had one, we were out a couple of years ago for Easter, a brunch. He had to give up his job. He was a driver, you know, he drove the bus to
Yeah.
take the old seniors to their doctor or whatnot. But he went to all these doctors and everything, and they still can't tell him why he's having them. It's, you know, they don't understand.
So they can't, they don't see a reason for having it.
Right, and I hate this, and I think his blood pressure is okay, but he eats salt like crazy. You know, like when
Is
we
he on
go-
blood pressure
I
medication?
don't think so, no, but the rest of the family is, I'm not. But when we get like McDonald's or something, he always has to have the salt shaker for the fries, and you know how salty those fries are.
Yeah.
And he's adding
Probably just
more.
have blood pressure. Or he's going to get it because, and yeah, I mean, that may be why he's having the strokes, I don't know, but he still needs to be.
Well,
really
he doesn't
careful.
have one, and that was, I don't know, 3 or 4 years ago.
So when he was younger, how old is he now?
With this, he'll be 55 in December.
Okay, so he's young, And